if I understand correctly, you perform both prenatal ultrasound and prenatal MRI, and
That's true.
you do it yourself.
Yes.
I must tell you, I haven't felt envy, like professional envy, for a long time in my life, but now I'm absolutely envious. Could you please tell me a few words about your experience, how you find this two modalities done by yourself?
Yeah, so I am lucky to have my dad who was a radiologist, my husband who is also a radiologist,
Great.
and that is how we both started our own venture more than 15 years ago. And I started with fetal ultrasound, and back then I was also an assistant professor at a local hospital. So that is where I started my experience with fetal medicine. So at that point of time, we used to scan more than 30 patients in a day. And that is how I gained experience with ultrasound, and then, of course, trainings. But at that point of time, like 15 years back, there was no fetal MRI training centers across the globe. So it was my husband who played a very key role in training me for fetal MRI. And it was like the disinterest of the radiologists in reporting the fetal MR, because we have a lot of other caseloads for radiology. So, and fetal MR being very time consuming and with no trainings available, I took the leap into the field as soon as
need 1 hour 30,
and
1 hour 40 minutes.
and developed the whole field actually.
Extra. The conference is more 1 hour.
Dasha, ти нас в ефірі. That's amazing story, and tells again how family is important for us, how our background is important for us. Then there are two questions, professional questions. What kind of pathology do you most often see besides the brain anomalies and besides the congenital diaphragmatic hernia? Because these pathology, which are mostly common, referred to the prenatal MRI.
So we see very, very few cases being referred for placenta and the placenta accreta spectrum. And we do see, actually, most of the times it is I am very well known for neuroimaging. So most of my referrals for MRI are for any abnormality which have been picked up in the brain, and then they refer to me for an MRI. And even in those cases, I first scan the patient by ultrasound and then take them for an MRI. And though the number of cases we get for GI abnormalities is quite low, because still the receptivity of the obstetricians for use of fetal MRI is very restricted. And they have become more acceptant to brain MRIs as compared to body MRIs. So still there is a lot of lag, but we get more of fetal spine MRIs and brain MRIs as compared to the gastrointestinal. And yes, CDH cases, of course, we do get references, but because in India, especially in Gujarat, we don't have any prenatal procedures being accepted by patients, or we don't have very many people doing it. So not many clinicians would be interested in sending the patient for prognosis or counseling unless the patient is willing for a postnatal treatment or prognosis.
Okay, I wish they could see your lecture, then they will change their attitude, I'm sure.
Yeah.
And my last question is, how early in the pregnancy, well, 20 weeks, 19 weeks, you would say this is a limit below which I wouldn't go for a normal assessing of fetal anatomy? Of course, we are talking not about normal fetus, but abnormal.
So the main factor which determines how low in the gestational age I go is the amniotic fluid level. So if the amniotic fluid is normal, then we have got good results even at the age of 20 weeks or 21. But otherwise, we prefer that we delay the scans to at least 24 weeks. Number one, because if it's a brain, especially, we get more information beyond what we see on ultrasound. And even if it's a bowel, we all know that the bowel signals are very well seen, even, I mean, from 24 weeks and onwards. So I guess if I have to give one time in pregnancy where we can get the best of the results, it's 24 weeks for both body or brain MRI. The earliest, and that is actually the limit for termination in India. Official limit has been extended to 24 weeks. So the latest I would prefer to see is a 24-weeker. But of course, we do get good results with even with 20 weeks, with 22 weeks, if the amniotic fluid is normal. And in my experience, we have seen that we get better results with cephalic babies as compared to breech, because MRI has a noise when the acquisition happens. So there is more movement in a breech baby as compared to the cephalic, because the head gets fixed in the pelvis while the scan is happening. Against there is no fixation of the head when it is up in the breech position. So that is my experience.
And what about, you have mentioned amniotic fluid, what about oligohydramnios or anhydramnios? Sometimes these cases are very challenging and maybe MRI can save this process.
So oligohydramnios is not a challenge for MRI. In fact, we can get really good information beyond what we see on an ultrasound when there is an oligohydramnios.
Okay, great. Thank you very much. It was a very interesting experience. Thank you for joining us today and for staying till the end.
Thank you so much for giving me this opportunity. I would acknowledge and thank Dr. Kurana, who connected me with this team of Extempore, and it was a pleasure being on this platform. Thank you very much.
Please be best regards to Dr. Kurana and my deepest gratitude.
Thank you so much.
Okay, dear colleagues, thank you very much for your interest, for your patience, for your endurance. I hope you found this course interesting and useful, and you will be able to implement your new bright, crisp knowledge at your working place starting on the nearest Monday. On behalf of organizers, I want to tell you that this course will be held also next year, so you all are very welcome. And you are also welcome to the course on ultrasound in obstetrics and gynecology, which will be held online on the 8th and 9th of December. Thank you very much. I wish you a great weekend. Stay safe and make knowledge.